The humerus. 4 things to know. All right, everyone. We've explored the neighborhoods of the neck and the shoulder's front door. Now it's time to look at the main pillar of the arm, the humerus. In the OR or on an exam like the MRCS, you don't just need to know the bone, you need to know what's hugging it, because if the bone breaks, those nerves and vessels are in immediate danger. Section 1. The 2 necks. The humerus doesn't just have one neck, it has 2, and they couldn't be more different in clinical importance. Anatomical neck. This is the slight groove just below the head. Its main job is providing an attachment for the shoulder joint capsule. Surgical neck. This is the constricted area below the tuberosities. It's called surgical for a reason. It's a common fracture site. Structures at risk. The axillary nerve and the posterior circumflex humeral artery wrap right around this neck. If you see a displaced surgical neck fracture, these are the twins you worry about. And by the way, they are walking as twins everywhere they appear. Section 2. Tuberosities and epicondyles. Think of these as the anchor points for the muscles that move your arm and hand. Superiorly, the tuberosities. You have the greater and lesser tuberosities, which serve as the essential attachment points for the rotator cuff muscles. Inferiorly, the epicondyles. Down at the elbow, you have the medial and lateral epicondyles. And here we must mention that the other name of the medial epicondyle is the common flexor origin, as it's the origin point for 5 key forearm muscles. And here is how you memorize it: the pass-fail method. Remember the mnemonic pass-fail, pass-fail? Fail. I hope you never fail. So they are: pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, which is the fail that lies deeper underneath. Another thing that the ulnar nerve runs right behind this medial epicondyle. Keep that in mind for any distal humerus injuries. Section 3. The anterior landmark, basipital groove. On the front of the humerus, the basipital groove, 3 muscles attach here, and for the MRCS, you must know their order from medial to lateral. We can remember those using the mnemonic TLP. So they are from medial to lateral: teres major, latissimus dorsi, and pectoralis major. Together, these muscles are responsible for shoulder adduction and medial rotation. So remember, bicipital groove gives attachment to the shoulder adductors, which are also medial rotators. Section 4. The posterior landmark, spiral groove. Finally, let's look at the back. Running diagonally across the posterior shaft is the spiral groove. The twins of the spiral groove. Tucked inside this groove are the radial nerve and the profunda brachii artery. Surgical insight. A mid-shaft humerus fracture is a classic red flag for radial nerve palsy. If your patient can't extend their wrist drop, this is exactly where the trouble is. Mastering these 4 key areas of the humerus, the 2 necks, the tuberosities, the bicipital groove, and the spiral groove, will ensure you can identify every structure at risk during a fracture or a surgical approach. That concludes this lesson. Now up to the next one.